I'm a high school football coach, but about 5 or 6 years ago, I was walking off my back porch trying to take some trash out, and there was ice on it that I didn't see, and as soon as I stepped out the door, I was slipping and falling, and I reached back with my right arm and tried to grab a railing, and I could just remember it hurting real bad, and I hit and slid, and it ended up being about 3 months. And it finally got to me that I just couldn't sleep. The pain in my shoulder was keeping me from, I never could get comfortable.
Rotator cuff anatomy is very complex. Our understanding of the rotator cuff is still in evolution, and I think everybody deserves a non-operative trial, medication, perhaps a cortisone shot, certainly therapy, and then if the patient continues to present with symptoms that are unsatisfying to the patient, we would look at advanced imaging, which in this case was an MRI. Initially, we felt that he had actually had what's called a slap tear. That's where the anchoring structures that holds the bicep tendon against the glenoid pulls away.
Dr. Salyers looked at me and said, well, I think you've got a tear in your shoulder and your labrum. And he then recommended I go get an MRI with contrast.
Most MRIs of the shoulder are shot without contrast, and it's a more comfortable experience for most people. But because we were concerned about the labrum, we wanted to get the contrast so we could get the most amount of information. As it turned out, he did not have a slap tear, but had a very large rotator cuff tear.
When they did the MRI, they found out the labrum was completely torn and it had fallen back where it looked like it was almost normal.
Jim was actually an ideal candidate for rotator cuff reconstruction. He's not playing aggressive overhead sports, so the reconstruction is not going to be subject to the demands that a younger athlete might have. And yet he still had good, vigorous, healthy cuff tissue that could hold on to a suture and could rehabilitate appropriately.
Physical therapy through a lot of time and effort was real well, so I feel like I'm back obviously to normal. I can throw a ball again, I can do stuff now that if I'd just not decided to do that, I don't know where I'd be.